Like if you see our moms, our grandmoms, they have really clear skin. They've never had this issue of PCOD causing acne or any of that sort. Why is it only us in this generation now, of course we're also old, but just the older generation after our moms and grandmoms are dealing with this issue, you know, that your gut and your skin and all of that is just all over the place right now. They didn't have that.
Yeah, because in those times the soil quality was so much better. Now if you see, studies show that the soil quality is depleted so much that the nutrition you are getting is very compromised. It's not having that kind of nutrition or the value that it would have maybe 2 decades ago. Second is lifestyles. We are more stressed out. We are trying to do a lot of household work as well as our workplace work, which was never the case initially. The stress levels have gone up, the pollution has gone off. So there are multiple elements which have got added to our lifestyle which they didn't have to, and that's why there is also a shift in, we see nowadays early aging because of those reasons, you know.
How do you know like your acne or everything that your skin issues are related to your gut or stress or hormones now? How do you understand the difference?
So it depends on the problem you're having. Right? So suppose you are having acne, for example. So normally teen acne is all over the face. So we know it's hormonal because your androgens are going up, your oil gland production is shooting up, and that's why you have that. After a certain point you will see acne at times, especially somewhere around the forehead.
Yeah.
So a lot of patients sometimes come to me randomly that I have forehead acne, and that's a clear sign your gut is off. So this is your gut area. So when this is off, so generally gut is one of the reasons, wherein primarily everything is clear but suddenly breaking out here. And then we as dermatologists see the type of acne you have and then diagnose, yes, this is gut and that's why it's happening. So this is a clear sign. Constipation or digestion issues, this will pop up, or you're having bad diet, this will again pop up. Then people have it here at the temples. That's more product related. Sometimes you use certain hair products, or your hair is coming all over the face. So when people say forehead is because of this, no, actually it is digestion. This is because of your hair products. Then we are looking at cheeks, though it could be pollution. A lot of times because you're traveling and all, the pollution comes directly on the face. So you look at pollution, or it could be hormonal changes, it could be certain products you're using. And then when you're looking at the mouth area, so a lot of times patients come with the irritation there or some breakouts there. That's not acne, it is an allergic reaction to maybe the toothpaste you're using or certain lip products like lipsticks you're using. Those can be giving you an issue. Yes. And then when you have it on the jawline or the lower face, that's clear cut, that's your adult acne. That's a clear sign that your hormones are off and there's something going on there and you need to investigate. So it's like a proper roadmap for us dermatologists that when you have an acne on a specific area, we know first thing is look at this problem, maybe a hormone, maybe a digestion, and then look at other problems which could be adding to it. So it's like getting the root cause of it.
And what about that one pimple that will show up every month?
That's God's gift and love to you.
Before every event, before your periods, after your periods, while you have your periods, it's
but
just...
that period pimple is a must. It's a huge tell that it's coming.
Yeah.
But why? Why do we get that?
So it is like, because you have estrogens and progesterone. Estrogen is what we love because it keeps your skin glowing, healthy, your oil glands in check. So that's the first 15 days after your periods. The next 15 days before your periods is when your progesterone, which is the villain, goes high. We need progesterone, but that is a culprit which is giving you, because it shoots up, your oil production shoots up. And thereby when your oil production shoots up, your congestion is more, you're bound to get blackheads, whiteheads, acne around that time. And then once you get your periods, progesterone again goes back to normal and estrogen starts climbing up. So before your periods, during your periods is the time when you get acne because your progesterone is high. And then it starts going down, and automatically a lot of times you see the acne dying down. So that's how it works.
Talking about PCOD, we're talking about women, we're talking about hormones. I've always had to deal with one thing. I have PCOD, and of course it shows in many ways. Whenever I would go to the doctor, the first thing the doctor would tell me was I needed to get on the pill, the isotretinoin pill, right? Or if I would go to the gynac, they would tell me the same thing, that you need to get on the pill. Now,
what is isotretinoin?
I don't know, I'll tell you. Like I've heard, which is what I want to know. I've heard like crazy stories and rumors, and it's very fear-inducing, this pill, because people have told me you can't get pregnant, you'll have mood swings, you have to be very careful with how you're consuming it. Even with the topical one, like people have like scared me saying that you can't use anything more than a pea size because if you use more, you'll
Sure.
break out and you know you'll purge and it'll be crazy.
No.
So tell me, what is the right approach? Why is it? What is isotretinoin, and should people actually even take it?
So isotretinoin is a drug form of retinoid,
Okay.
which is a vitamin A derivative, we'll call it, or analog. So there's no linkage to steroid first A, but it's a potent drug like any other drug. You know, people are popping paracetamols and azithromycin or so many antibiotics like crazy. So every medicine which comes in the category of a drug will have effects, thereby it will have side effects. So it's a controlled medicine. Now what happens, what I have seen is isotretinoin is a drug form of retinol, and it is US FDA approved for acne worldwide for years. It has beautiful papers. It is for me one of the best drugs that I can give for my acne patient.
Okay.
But it is a drug. What is happening is people are buying it unfortunately and popping themselves unaware of the side effects, and thereby the side effects come.
Kids too?
Yes.
Oh.
It's sad. So that is what happens. Every drug has its limitation side effects. As a dermatologist, I know how to harness that drug.
Yeah.
According to your body weight, I'll give you a certain amount of dosage. I will monitor it for any effects or side effects. And then I will accordingly taper it and stop it. Now when you don't do all those, it's like a weapon in your hand. If you don't fire it right, it will have side effects. Yes, effects like mood swings are known with it. That's why when we do a detailed history, we ask, do you have any antidepressants or you have a past history of mood swings or depression, and thereby then we take a choice or informed call with the patient that should we do it or not, and
What
we monitor
do you do
it.
then if for someone who is borderline depressed, has anxiety, maybe not clinically proven, but is in that gray area?
He's mentally struggling with mental health.
So
in
there are
some
few
way.
parts of it. Understand, acne, especially severe acne, itself adds to depression.
Yes.
So therein, I generally would avoid in a patient who has these kind of, underlying or pre-existing issues like mood swings or depression history. I would want to stay away from isotretinoin because it can worsen the thing.
Oh.
But at the same time, there have been cases where the acne itself has caused so much of trauma to the patient, wherein in discussion, in a very, monitored manner, we have given in consultation with a psychiatrist, and all it has worked very well. So it cannot be taken by self. It's a drug, please remember, and make sure you follow a doctor and do the drug properly. Yes, it should not be given if you're planning a pregnancy, because studies have shown that it can cause birth defects. So we always do again a history. Are you married? Are you planning pregnancy? What is it like? And then accordingly stay away from the medicine if a pregnancy is in the works. But before that, you can definitely take it. I have patients who have taken it 4 years, later on got married, got kids, absolutely fine. So you have to treat it with respect as a drug.
Correct.
But there's one more question to this in terms of drugs. Doctors also prescribe antibiotics, right, when you get acne, because they say it's bacteria caused. But I know that antibiotics also will create some issues in your gut.
Absolutely.
And that then can create more acne. So
Absolutely.
then again, that is a circle, right?
So I think we are confusing the two things. Acne is a byproduct of multiple reasons, not only gut.
Okay.
It could be because of hormonal changes, stress, various factors. Gut is one part of it.
Yeah.
When you're coming to antibiotics, if again we give it in a short manner, does not harm. But if you're giving for long periods, it will wipe out your good bacteria. And there is when the gut microbiome gets affected, and then the problems start.
Correct.
So you have to be aware, and also a lot of patients keep popping, as I said, antibiotics by itself. Don't do that.
Yeah, I think everyone's taken azithromycin for a
Long period of time.
headache or fever
yes.
now. Yeah.
So people, again, when you come to painkillers, a lot of people just pop in a painkiller thinking, oh, I have a headache, let me do, I have a meeting. But that itself is affecting your gut because it's again affecting your good bacteria.
Very, very interesting for me is, as a woman, today I'm 40, but I've seen that, women have gone through so many different phases of life. You're a child, then you get your, you start your menstrual cycle, you get your period. It's a whole different journey. After that, you want to give birth to children, so you're trying to get pregnant. Some people have to do IVF, IUI, pumping yourself with more hormones. You then have kids. Then before you know it, it's perimenopause, menopause. So it's like by the time you get used to one life cycle, you're at the other one. How do you manage your skin through all of these different parts of being a woman?
By one, I would say giving it time, being patient and giving love to yourself and not bashing yourself up
Yeah.
to all the time have a
Very
perfect
difficult to
skin.
do.
I know it is
Very
difficult,
difficult to
because
do.
we live in the world of filters and perfect skin and
Absolutely.
those kind of realities. But yes, we have to again, like I was telling my patient that day that just to go off track, I had a patient who came to me. I started seeing her at 22 years of age, moderately good girl, and at 29 she's getting married, and she told me, doc, one statement stayed with me and helped me. You told me at 22 I had a face full of acne, I was overweight. You told me you're beautiful the way you are, and I love you for it. I don't want you to change
Absolutely.
it. And I think she said that statement carried me through these years, and I'm so confident because of it.
Correct. So
I
beautiful,
think
yeah.
we miss that, right?
Yeah,
So-
absolutely.
That validation from this one person
Yes.
to tell you that, listen, you're just okay.
So I think we need to do that as women. We are always hard on ourselves. We, as you said, we are through different hormonal journeys, life journeys. Somewhere we have to keep telling ourselves, I'm good. I know I have a bad skin day, but that doesn't mean make me define me or make me less. I know I'm being very, philosophical, but
No,
I
but it's
think,
important because
yes,
I think
it's
this
important.
is something that is the crux of everything,
Yeah,
right? Like you just
absolutely.
be kinder to yourself first,
Absolutely.
Yeah.
and then
I think for me as a woman, that has carried me through, telling myself that it's okay to
the fine
have-
lines are okay, the acne is okay,
Absolutely.
the pigmentation.
Absolutely.
Let's not forget the men. While we've spoken
Yes,
about
yes,
women,
yes.
men are important.
Yes.
I want to understand, like, we have this 30-day cycle, right? I think men have a everyday cycle. So how is their acne different? Like, how is male acne different from female acne?
So in males, they don't have this progesterone, estrogen issues happening. They have less
Correct.
of it, and they have more of testosterone. So more of androgens. At the same time, the male skin is more thicker. They have little more oil glands. They have little thicker collagen. So those are the greater benefits
Yeah,
they have
But
as
that's
men.
true. I have friends who like have great skin at 40, and I'm like, what are you doing for your skin? They'll be like, I use Lifebuoy soap, and that's
Exactly.
it.
Yes, yes.
My husband, he uses synthol on his face.
And that's it.
And
They don't do any,
clear.
not even a moisturizer. And here I'm putting products on products, and I'm still struggling. Why is that?
That's because of those hormones that you're going through, which men don't have to go through as much.
Yeah. Okay.
And again, society is not as hard on women and non-men than they are on women.
Even here, it's difficult for women. Just imagine. Everywhere.
So I think they have certain greater benefits in terms of structurally and genetically they have those elements. At the same time, their acne would be similar. They would get hormonal acne also.
Yeah.
They would get more of forehead acne because it's more gut related for them more than hormones. It would be more product related, so they would get back acne because they are using certain gym equipment or they are taking certain gym supplements which are affecting it. So they have the acne but in a different causative form and those kind of things.
I also want to know, there's a lot of these new therapies, the gua shas and the microderma rollers and the red light therapy and the ice dunking. There's so much to do. Does it really help?
I will say yes and no. One, while it's great that there's so much to do in the skin world and people have so much access because we are in a country where not everybody can access a dermatologist. But it's important to understand whatever new comes, what is the science behind it, who is talking about it. Is it a certified dermatologist or is it somebody else who's not certified to do it? What is the motive behind it? So it's important to say, yes, when I'm doing these things, I should be feeling good about it. Maybe some lymphatic drainage, maybe the skin will feel good, but it's not going to treat your acne. It's not going to make your wrinkles disappear. So those realistic understandings are there, absolutely fine. Again, things like microdermabrasion or derma roller should not be done at home because you're needling the skin. It's going to breach your skin, cause infections or long-term damage.
Correct.
This is a very popular saying in North. My mother used to say, because just because your friend is going to jump in the well does not mean you go and jump without knowing what is happening there.
True.
So, like during pregnancy, your body, of course, you don't know what's going to happen. You're already in that process because you're scared and you're doing multiple other things. I think skin is the last thing you're caring about while you're pregnant.
Absolutely.
And after you give birth, I think, I'm sure you can answer this, that after you give birth, then there is no time for yourself at all. So what are the things that you can do before you conceive to at least take care of your skin after you've given birth?
I thought pregnancy glow was real. I'm getting acne, I'm getting pigmentation. What's going on, doc? So it can go either ways.
Yeah.
Again, don't beat yourself because that's your natural hormone going to happen. I tell my patients get through your pregnancy, get through your feeding. We'll deal with it later. Right now, just enjoy this, because it's like, just you can't do anything about it.
Enjoy the
because
process.
you're in a process where I can't give you any actives, I
Yeah.
can't give you any medications, I can just manage with basic stuff, which may not be enough. So for now, there's no point in beating yourself. It may happen despite the best skincare or the routine
Yeah.
that you follow, because that's hormones, right?
And I think food again, right? Like
Yes,
we've been talking,
yes,
if you're going to
yes.
be eating healthy for your
Yes,
baby, so
yes.
automatically everything starts showing
Yes,
in your
absolutely.
skin.
Yeah.
True.
So,
My hair
but
became great during pregnancy.
I know of someone, she's a cousin, and she gave birth to a second child, and she had straight hair, like straight hair, beautiful silky straight hair. She gave birth to her second child.
And became curly.
Yeah.
Yes.
How does that happen?
Hormones behave and your body behaves very different. You can't control it. But if it happens, then we wait till you finish your feeding, because before that we can't do anything. And then we decide that, yes, is there some intervention we can do? How can we improve it? How can we change it? But there are certain body mechanisms, even without pregnancy. I have patients who have had straight hair over the years, suddenly it turns wavy or curly. So your hair and skin changes with age, your body morphology, biology, a lot of factors.